Hi, my name is Karen Berry and I am a student at Durham Tech Community College. Today I will be presenting my final presentation for Biology 168, Anatomy and Physiology 1 on pheochromocytomas and the effects of catecholamines. In this particular case study, we had patient Helen Ames who presented with severe menopausal symptoms, which included a throbbing headache, racing heart, visual disturbances, clammy hands, nausea, and etc. Initially, she was prescribed hormonal replacement therapy in the form of estrogen, and this prescription was made over the phone. However, her symptoms resulted in no subsiding of her symptoms, and her attacks became more frequent, and so she decided to have a face-to-face visit with her doctor, where she presented with severe hypertension, which caused her doctor to run some more tests, which included a VMA urine test to rule out pheochromocytoma. However, once her results were in, her urine test revealed excess catecholamines in her urine, and upon a further scan, it was revealed that she had a pheochromocytoma as her diagnosis. So a pheochromocytoma is a mass that's located on the adrenal glands, and for anatomical reference, those are directly superior to the kidneys. And what happens in the presence of a pheochromocytoma is that epinephrine and norepinephrine are secreted in excess or unregulated. And so symptoms of this can include either spouts, like in Miss Ames's case, or sustained hypertension, tachycardia, nausea, anxiety, weight fluctuation, sweating, and etc. So you can see how this would be very difficult to diagnose, as these symptoms kind of encompass a lot of physiological responses to different things going on in the body, like in Miss Ames's case, where she thought that it was severe menopause, or these symptoms also can be indicative of high stress situations. However, it is crucial to properly diagnose this, as it can be fatal if left untreated, or mistreated or misdiagnosed. So just a quick review of the adrenal glands. These are part of both the endocrine and nervous systems. Endocrine because of the hormonal relation, and nervous systems because of the body's actual physiological response to its surroundings. And so the adrenal glands are actually what is responsible for the fight or flight response in high stress situations. And so ultimately, the adrenal glands regulate the secretion of epinephrine and norepinephrine into the bloodstream. And so the effects of catecholamines, let me move my picture really quickly. The effects of catecholamines, specifically epinephrine and norepinephrine, are going to be addressed within this presentation. So epinephrine's street name, sort of, if you will, is adrenaline. And so you always hear of the adrenaline junkies, such as like in the photo in the background and everything, and that's kind of searching for this rush that these hormones produce. So epinephrine's role is to relax smooth muscles, and then constrict the blood vessels in the kidneys. And norepinephrine is responsible for increased blood pressure and increased heart rate. So if you think quickly to the feeling that you get right before a test or a presentation, or motocross racing or anything like that, that is actually your body's physiological response to these two catecholamines. And so for diagnostic testing of a pheochromocytoma, sorry, I'm going to move myself again. The most widely accepted and used testing is a VMA 24-hour urine test, like Miss Ames received. They are relatively easy to perform and readily available. However, they can produce erratic results. There is literature that supports plasma catecholamine assays, as they can be faster and can actually correlate the catecholamine levels with cardiovascular status, which has proven to be widely successful in diagnosing pheochromocytomas from the laboratory perspective. And so as a result, there is increased accuracy. Another test that used to be used was spot urine tests. However, they always yielded a high rate of false positives and were relatively inefficient in regards to the fact that they took the same amount of time as a VMA-specific urine test. So where this sort of differs from the VMA test is that this measures the total metanephrine analysis as biomarkers for pheochromocytomas, but that isn't always the case. VMAs are proven to be more accurate as biomarkers instead of looking at it as from a total. So then the treatment of a pheochromocytoma, the alpha adrenergic receptors are normally first used to treat the relatively high blood pressure, like Miss Ames presented with. So the actual role of this particular treatment is to bond with residual hormones in the bloodstream. So in this case, it would be the excess catecholamines. And the result is vasodilation, which will decrease the blood pressure and a decrease in peripheral vascular tone. However, the risk associated with this is tachycardia. And the most common receptor for this particular, for the alpha treatment is phenozybenzamine, and this is also what Ms. Ames received. Then typically also prescribed with it is a very low dosage of a beta adrenergic receptor, and the role of this is to actually effectively address the tachycardia. The most widely used drug for this is propranolol, and this is also what Ms. Ames received. And so the effects of both of these treatments together is that the blood pressure is brought under control, and the heart rate is also decreased and brought under control, which then makes surgery a viable option for the patient to have the pheochromocytoma removed and then subsequently have chemotherapy and radiation if necessary. So really quickly, I just wanted to emphasize the importance of a correct diagnosis, as there can be fatal repercussions. These repercussions can be a result of the overproduction of catecholamines and the subsequent effects of this. So the overproduction of catecholamines, specifically epinephrine and norepinephrine, can create many cardio issues such as cardiomyopathy, heart failure, severe hypertension, and if diagnosed at a reasonable time, then many of these can be reversible symptoms, but if left untreated, then these can create longer-term issues for the patient even upon removal of the pheochromocytoma. And so with that, I just wanted to quickly refer to a related case that I found while studying Miss Ames's case. And this was from the American Heart Association, where a 43-year-old woman presented with all of the same symptoms as Miss Ames. However, she did not have a successful diagnosis initially and was given propranolol to address her high tachycardic heart rate. However, the use of propranolol alone resulted in left ventricle heart failure for her. So fortunately, they were able to catch it in time and reverse this effect of propranolol alone by giving her phenozybenzamine, as in Miss Ames's case, and then effectively removing the mass from her adrenal glands. But once again, I just wanted to illustrate the importance of properly diagnosing a pheochromocytoma and the importance of being aware of rare diseases and different physiological responses that our body can have. And with that, I am concluding my presentation, and I hope that you have a great rest of your day. Thank you.